but it's large.
Yeah, so I mean, the reason that they wanted you to see me was because there's some fluid in your chest that got a lot bigger now.
Right.
What was it? It's G what? G8. Okay. G8.
What's the strange spelling?
Alright.
Geary.
So the maybe I looked at this scan that was like older. That's what I didn't look at the newest one. I saw this one from the Virginia. Yeah, it was like all labeled wrong is the problem. Okay. So but yeah, you have this thing. It's down here. It's all this weird
Gray area.
cystic looking thing that apparently is getting better, I guess they said.
Well, maybe. They didn't say that it was getting better, but
What I'm worried about is that, so it almost looks like some sort of infection or something. This stuff, and then the problem is, the thing I'm worried about is that it looks like it extends up along here because this is fluid in his chest now.
right. And it's also, he's got a knot protruding between his ribs. That's part of that.
Yeah, that's part of that
Mass.
thing. Yeah. So what I'm not sure about is whether this stuff is extending up and then through the diaphragm into the chest is what my concern is. So what I'm going to recommend is that we start with just getting the sagittal axial. Here we go. Because I can't tell if it communicates like right here into there. This is that knot between his ribs below
Yeah.
down there. So what I'm going to recommend is having our interventional radiologist go put a needle in there and drain that out and see what it is.
Okay.
See if it's pus. See if it's fluid, thin fluid. If it's thin fluid, send it for culture and send it for cytology. Make sure there's no cancer in it, and then see. Because if it's simple, meaning that it's just thin fluid, they should be able to put a drain in it, drain it out. Your lung will expand and fill up that space, and
That'll help with the coughing.
yeah, it should help with the cough, and it should, you know, it may come back, but it probably won't. But my concern is it could be either communicating with this other stuff over here, or it could be reactive.
Okay, so what's the other stuff though? I thought it was all one big mass.
Well, it's not like a mass. It's like this sign of this stuff. It's kind of this nebulous sort of. Maybe there's fluid here,
Right.
inflammation between the muscle layers. Because this is what it should look like over here, and it's kind of this. I don't know what it is.
Right. I mean, could it be a cyst?
No, a cyst is usually pretty cyst kind of looks like this usually. It's like very
Right.
round and filled with fluid. This is very complex and almost looks like either that's why I have to rely on the other doctors to say who deal with that kind of stuff. The radiologists don't seem to know either what it is.
Right. Yeah, nobody has said that. Well,
They know what it is.
I mean, they kept saying it was cancer, I guess theoretically it could still be cancer.
Yeah, I guess Dr. Jane was worried it was, what did you say, liposarcoma or something?
Yeah, that's
Yeah.
what they told us. Liposarcoma
Yeah.
in the retroperitoneal space or something.
Yeah, that sounds about right. So, yeah, I don't know about that. This I know that we can drain it,
Right.
and if it's all simple fluid, meaning that it's very thin and clear, it should all drain out, and his cough should get better. If they can't drain this out, or it's thicker and it's like infected stuff or some other type of mucinous stuff, then I might have, then I'll have to talk to them about figuring out what this is. Now the question is, if we're going to have them go do this, should we have them try to biopsy this? If they haven't put a needle in this at all, right?
No.
There's been nothing.
Okay, that's why I need to talk to Dr. Jane about.
Because that still could be cancer, right?
It
I mean,
doesn't-
it's
it doesn't
possible
look.
or
It
not
doesn't.
possible.
It doesn't look like a typical mass, but I don't look at a lot of liposarcomas, so I don't know.
Okay.
Well, that's what they were saying, that they didn't think it was cancer. Even after when we saw Dr. Jane, he was just like, it's cancer, you know, it's too advanced, we can't do surgery, you're too sick. We were like devastated, he's gonna die in a week. I mean, they didn't say that, but that's what we
Basically,
got.
Yeah.
Then they have the radiologist look at it and they call us and say, oops, nope, not cancer. So that was a little strange. And then they brought us back up here for another CT, and then they called us back and say, nope, really still not cancer.
So really nobody knows
But
what it
nobody
is.
knows what it is,
So
and they
they
haven't done anything.
Need to do a biopsy to find out what it is. Somebody needs to figure out what it is.
Yeah. I'll ask him to see if they get you, because if they're gonna put you under if they're gonna do if they're gonna drain that fluid, then they may as well stick a needle in that area and see what it is if it comes out, and
right.
do them both at the same time.
But they're in two sort of separate areas, is what you're saying. The fluid that you think is fluid and the other stuff is in two separate areas, or are they two separate things?
They could communicate. I can't tell.
Right.
They could be completely separate, but I'm worried that they could communicate, and that maybe this is some sort of weird infectious thing, and it's draining into the chest, because it does look smaller on your most recent scan, all that stuff, whatever it is. But I can't tell you. I have no
Right.
idea.
I understand.
At least you're not guessing. I like that.
Yeah.
But I think starting with putting a needle in there and trying to drain it out is a lot better than
Well, that at least would give you.
I don't want to go in there with a camera and you do surgery on you and go
Right.
do something first off. I think we'll start with trying to drain it with a needle and then kind of see, and then I'll ask him and try to see about put a needle in the lower stuff too, maybe.
Okay.
Get two of them going.
Yeah.
Well, it's better to know what we're dealing with.
I'm not a doctor. I just feel like the sooner we figure out what it is, the sooner, there's a chance that what if it's aggressive or whatever it
Yeah.
is,
Yeah.
and it's just keeps getting put off and off and off.
Yeah, exactly. So
But you think it's getting smaller from the last time? This last CT scan, it was smaller than the
yeah,
previous.
but then the lung stuff is a lot bigger.
Right.
So it could be that if this is some sort of weird fluid thing, it's just worked its way up into the chest and it's just decompressing the chest, and that's why this is smaller.
Maybe.
That would be weird, but I've seen weird things, and
I'm worried first.
Yes. Okay.
So what is going to happen? We'll put it in order. I'll communicate with the interventional radiologist. They will call you. I think it's usually I can't think of her name, but they have a nurse who does all the coordinating, all their procedures and stuff, and she'll call you and get it coordinated and set up a time for you to come in and have them do the drain. Okay.
Okay.
All right, and then we'll see. In the meantime, I'll talk to Dr. Jane and see if he wants us to try to add on another biopsy of the other stuff at the same time.
I have just one more question about his
Yeah.
appetite. So is this fluid or whatever it is pressing on his stomach to cause him to not have an
No.
appetite? Because I just thought that it was pressing on his stomach and that's why he was having a hard time eating.
No, this is his stomach right here.
Right, so it's not pressing on his stomach at all.
No.
I just can't explain the rapid weight loss, this 100 pounds in
Could have said.
7 or 8 months. It's just a lot.
I mean, if he's got some sort of chronic, if this is some sort, if it's cancer, then that would explain.
Right,
But
and
if it's,
that's my
but if you
concern.
have a chronic infection or some sort of weird, like, where you're not like super sick from it, but there's some like chronic infectious things that can cause you to have a lot of weight loss and not be able to put on weight and calories, even though you're not like otherwise super ill, meaning that you're not having fevers and chills and all the other things you usually do if
He
you
just
have
does
an
not have
infection.
an appetite. Like he
Yeah.
says he's not hungry at all, and then sometimes when he eats, he has nausea and vomiting. So
Yeah.
I just thought maybe it was pressing on his stomach and causing that.
No, unfortunately not. That doesn't. I don't have a
It
great
doesn't
answer for
explain
that.
it. All right, well, it is what it is. I guess
No.
we'll figure it out.
We'll start with the fluid drainage and see what that is, and see if
At least we're starting some.
that might
Right.
help us out, or it may just be reactive and doesn't put us back at square one. But let me talk to them too and see if we can have them see if they want us to biopsy their stuff down there below too. And
So if that doesn't give us
I
some
hope it
answers,
is.
what could the next steps be? Would it be a surgery to actually look at this from the inside, or, I mean, what?
it wouldn't be me doing that down there. I mean, if the stuff doesn't drain out of the chest, then I might have to put a camera in his chest and see what's going on in the
Right.
chest and why there's fluid and what's going on. But the other stuff, I don't know.
So I'm sorry to ask another question, but is this fluid that's getting into his lungs that he's coughing up, how is it getting into his lungs from that fluidy mass? Does it just absorb, his lungs just absorb it?
What are you coughing up?
Clear
Yeah.
mucus.
So it could be that it's phlegm because that fluid in there is compressing some of his lung. So some of that lung is compressed and collapsed, and so that phlegm is just kind of sitting in there and pooling. So that's probably what he's coughing up. It's not that the fluid is coming from outside the lung into the lung.
Right.
It's just that lung is collapsed and
Smaller.
irritating the lung and causing him to have a cough and having
Right.
that stuff accumulate and cough it up.
It's a lot though.
Yeah.
It's quite a bit. Like I would think he has pneumonia. I mean, I know he doesn't.
Yeah,
but
'cause
it's
he
almost
coughs
like
like
he has
bagfuls.
pneumonia. It's
Yeah.
a lot.
But I put it in the Kleenex, I do,
Well-
every time.
Well,
Get rid of it, and, you know, 'cause I don't want to swallow
Yeah.
it. Put it back in there.
Yeah. Gotcha.
But it's a lot. Like he goes to a couple boxes of tissues a day.
Yeah.
That.
All
It's a
right.
lot.
Okay. Well,